Hi class, this is Professor Franks, and I'm very sorry that I can't be there to teach you in person, but I'm going to try and do my best to get the information to you quickly and in a way that you can generate some questions and let me know via email, and maybe we can have some discussion at a different time. Today we are going to talk about coronary artery disease. So basically, when I have this slide up, this is where I take the opportunity to ask you what you can tell me about coronary artery disease. And I'm assuming a lot of you would say plaque buildup, blockage of arteries, things of that nature. So right here, this is just a nice picture. There's nothing you need to memorize on this. However, what I do like is that on this picture you can see the different types here, I'm pointing in, of stages of cholesterol buildup, okay, and in different coronary arteries. So obviously with this being partially blocked in the circumflex, these being completely blocked, it says 100% occluded. Not good. This obviously, depending on what coronary artery it is, would surely cause death to that part of the muscle and cause a heart attack. I'm also going to apologize too. I have a cold, so I apologize if I sound funny. So again, this is blockage of the arterial vessels leading to the heart. Okay, just a nice picture there. And they can be, as I told you about my Professor Kate Cook's husband, be in a single or multiple vessel of blockages. He had 5. They corrected 4. He clotted off 1, so now he has basically 3 of the major vessels that are have been bypassed and are open. So the incidence of coronary artery disease, as we've kind of already talked about in several of our lectures before, is that it's pretty darn high. Cardiovascular disease remains the leading cause of death in America. That is not a surprise. That's not new information. 1 in 3 persons suffer from some form of cardiovascular disease. Whether this is true or not, I've actually heard that depending on a mother's diet, you can actually, the babies in womb can actually start to build cholesterol and plaque in their arteries in the womb. So obviously this is genetic and also diet related, exercise related, etc. More than 400,000 Americans die from cardiovascular disease or its complications every year. That's such a big deal, especially when a lot of it can be avoided simply based on our lifestyle. In the US, someone has a heart attack every 43 seconds. That's amazing to me. When I think about how long we sit together in lecture, almost 3 hours, and how many people at that given time die of a heart attack, or should I say, have a heart attack. That's a lot. That's a lot. Each minute, someone in the U.S. dies from a cardiovascular event. So there you go. Each minute, right? So 60, if that's 1 a minute, that's 60 in an hour, obviously. 180 in 3 hours. Coronary artery disease claims about as many lives each year as cancer, chronic lower respiratory diseases, accidents, and diabetes combined. That's amazing to me. When I saw that stat, and it was probably on the CDC, I was blown away because we hear about so many people dying from cancer. How on earth can cancer, respiratory diseases, accidents, and diabetes combined still be less than coronary artery disease? I think that's very powerful. That's a powerful statement, and it should open our eyes to this disease. Mortality. So while the incidence has increased over the past 60 years, actually the numbers of deaths have decreased. And of course, at this point I would ask you, why do you think that is? And you guys would tell me, well, because of technology, right? Technology has improved because of education, because of what nurses do, what doctors are up on, the research that has been done. We know that we have done a great job of educating the public on what are the signs and symptoms of having coronary artery disease, or even having a heart attack. So we know what these symptoms are. We know that there's some shortness of breath. We know that there's fatigue. We've done a great job of telling the public that. In addition, we've also said if you have these, you get to the ER, and then we have educated our ER staff and our hospital staff to know that we need to get them in here. We need to do an EKG within the first 6 minutes, and we need to do A, B, C, and D so we can prevent a heart attack. We also know that the technology, so once we've determined what is going on with them, we have procedures that we can do that can rectify the situation very quickly. So early detection and triage, which is what I said. So you already kind of know, gosh, I got some of these symptoms, I better call 911. Or maybe you're the one saying, I just know it's probably not that, but it's your loved one that calls 911. Treatments are both surgical and medical, and they have totally improved with the different type of medications that we use. And not only the different types of medications, it can be some of the same medications, but in a different way. Okay, we're going to start with this first. We're going to do this next. We have a stepwise fashion that has been working for us. Use of thrombolytic drugs. We'll talk a little bit more about that just briefly, because we'll talk more about acute MI in 241. But thrombolytic drugs, and what that means basically is they're kind of considered clot busters. So you've already developed a clot, and this is going to help break it up. It doesn't prevent them. It just helps to break them up. Modification of risk factors. We know what the risk factors are, okay? So now we've got some education, now we know how to prevent them. And that's our goal. Obviously, we don't want them to develop coronary artery disease. So here are the things we need to do to prevent that. So what are the risk factors? Non-modifiable. So we can't do anything about them. So what would be the first one you would think about? One of the first ones. Your age, right? You can't do anything about your age. And we all know as you get older, we are going to have a greater chance of developing coronary artery disease. Years and years of abuse and poor diet is going to increase our chance of coronary artery disease. Let's see here. I'm just making sure I'm not missing anything on my notes for you. Okay. Typically with coronary artery disease, it's not anymore like we had already talked about, a 6-decade disease. It can happen, it begins very early on. And with our children and obesity in the United States so high, it's happening and beginning and developing right then as children. Certainly, definitely more prevalent, and actually symptoms have been found as early as our 20s and 30s. So it is the major cause of death among men 35 to 44 years old. 40% of the deaths in people age 65 and over are caused by coronary artery disease. So it is a big deal. While more men, it's more common in men, coronary artery disease is the leading cause of death among women. So we know now that coronary artery disease, myocardial infarctions are a number one killer of women. That's not become a surprise. It's not a man's disease. Next, we can't modify our race, right? We're born as something. So we know, we've already talked about also that African Americans tend to have a higher rate or higher risk factor for developing coronary artery disease. heredity, right? We've inherited it. Me and my sister have different dads. My dad died when I was 14 months old. My mom remarried and had my sister. My sister's father died fairly young. I believe he was 66 years old. One, he was a horrible smoker, but also his own genetics. He, by the time he was 34, had his first lung collapse and heart attack. He had at least 4 heart bypasses. My sister, as a very young woman, she is 35 now, but diagnosed very early on that she had high cholesterol in the 300s. No medication on this that would be prescribed to her is going to bring that down. That is hereditary. And then again, gender. We can't change male or female. And that's who we are. And again, we know that it is the major cause of death among men between 35 and 44, but also that it is the #1 killer among all women. So, for risk factors, excuse me. 49% of Americans have at least one of these 3 risk factors. So modifiable, all right? We have here, sorry, I'm missing the page. Oops. So modifiable, right there on the screen says environment, right? And the reason why we say environment, in case you're questioning that, could be where we work. A long time ago, factories, and things of that nature. Also, depending on if you're in a household, maybe you don't smoke, but maybe you're smelling secondhand smoke, okay? We're in a generation where our baby boomers are now the ones we're taking care of and are getting out there and are retired. It was nothing for them to grow up in a household where everybody smoked in the house with all the windows closed, drove in a car with sitting in the back seat and mom and dad are smoking with the windows closed. So also our environment, not to mention smoking in general, right? So there's no question there. Smoking is just a precursor to so many bad things. I don't need to get into that. But you can see where it says 49% of Americans have at least one of these 3 risk factors. So that those starred there, smoking, hypertension, and elevated serum lipids. Those are the 3 major risk factors there. And we can modify these. We can modify our obesity. We can lose weight, right? We can get off the couch. We can have a less stressful job. Or maybe if we're somebody who's so anxious all the time, maybe we need to do something. Maybe we need to meditate. Maybe we need to take some stress relieving exercise courses and kill 2 birds with 1 stone. Maybe we need to find a different job, or maybe we need to take some medication temporarily until the stress can be dealt with. Hypertension, we've already talked about hypertension. We know why that's a risk factor. Diabetes and elevated serum lipids, which we'll get in a little bit into. So I want you to pay a close attention to those types of things. We're going to talk what I want you to know about smoking in general. I think somebody in here in the class had mentioned it when we were talking about it briefly, is smoking is actually, you are 2 to 6 more times at risk for one. And the risk is obviously proportional to the number of cigarettes that you smoke. And if you reduce or if you quit, your risk is reduced by 30 to 50% within the first year of quitting. That's huge. That's huge. So don't think, it's too late. No, it's not too late. Okay? So what about smoking causes the risks? What does it do to your body? What do you know that it does? Well, basically, there are substances in the cigarettes that actually causes nicotine to be released. Actually, that causes epinephrine, okay, and norepinephrine to release. Well, we already know what those 2 things do, right? They cause vasoconstriction. So if you're a chain smoker and you're constantly smoking, you're constantly causing epinephrine, norepinephrine to be circulating in your body. So you're going to have an elevated blood pressure, an elevated heart rate. So it's going to increase your O2 consumption. Your body's got to work harder. It also activates platelets and the stimulation of smooth muscle contraction, right? So it also causes cell production. So all of those things which are bad, right? So let's say you have plaque buildup in your vessels already. So now you're smoking on top of that, right? And you're causing an increased heart rate, an increased blood pressure. You're also causing constriction on top of that, narrowing that artery and the amount of blood that gets through it. But at the same time, you have an increase in O2 consumption, right? So, but you can't get enough blood to your body. At the same time, an activation of platelets. We're going to talk a little bit more about how platelets play a role in heart attack. So platelets go to an area and cause a clot. And I already mentioned earlier that clots are the reason that we have heart attacks. So all of those things I just mentioned are caused from smoking alone. That's huge. So I can't say it enough that quitting smoking is imperative, not only for you, but for our public. So as nurses, we have to be very good about educating and expressing these types of preventions to decrease coronary artery disease. We have to do a great job at educating our patients. So right here, guys, don't forget, you're going to want to know these, the modifications, okay? These are modifiable. We can do something about all of these things. All right. So risk factors. This is metabolic syndrome. Metabolic syndrome is a clustering of risk factors for both diabetes and heart disease that occur more often together than alone. So that risk factor. All right, so we have just the risk factor of obesity, okay? Obviously, if we add on smoking, we add on hypertension, or we add on some of those things that are mentioned down below, these 3 of 5 right here, that we can show that our risk factor is obviously higher with multiple risk factors than if we just had one. That's not rocket science. So people with a metabolic syndrome have twice the risk of developing heart disease. So if you have metabolic syndrome, you have 3 of these 5 things: insulin resistance, central obesity, dyslipidemia, hypertension, elevated CRP, and fibrinogen. Okay, so 47 million Americans have metabolic syndrome. 1 out of 6 people. It runs in families. It's most common in African Americans, Hispanics, and Asians, and Native Americans, okay? So it's a group of risk factors: high blood pressure, high blood sugar, high cholesterol, okay? So we tend to see things that are like that. If we have all 3 of 5 of those things, and look in your book, it's described in your book in Brunner, metabolic syndrome, 3 of the 5 risk factors equals you'll be diagnosed with metabolic syndrome, okay? It doubles the risk of heart disease, heart attacks, and increases your risk of diabetes by 5 times. That's a lot. Metabolic syndrome. So what causes it? Well, they really kind of believe that insulin resistance is primary cause. So there's an overproduction of the insulin. We can't sustain it. Our insulin levels fall and glucose fails to be regulated. Okay, so we have diabetes. Results: you have type 2 diabetes, you have hypertension, and dyslipidemia. All of those cause this, and pro-inflammatory, pro-thrombotic, which basically means you have increased inflammation and increased thrombosis.